Hello, my name is Amaya Marshall, and our group's topic is hospital segregation in America. And my main focus will be the explanation of the argument on why hospital segregation was big past plus present day. What if I told you that going to the hospital meant fearing discrimination instead of finding help? Hospital segregation was built in the US healthcare through law and funding decisions, and its effects still harm Black patients today. The only right thing is to acknowledge this history and take action to ensure equal treatment for everyone. This leads us to the real issue, which is how segregation shaped hospitals in ways that continue to harm Black communities today. Hospitals were legally segregated under the Jim Crow law, which mandated hospital segregation, enforcing racial separations in facility, patient care, and staff. According to the AMA Journal of Ethics, legally sanctioned racial hospital segregation ended with the Civil Rights Act of 1994. As per the National Library of Medicine, racial description in medical services and facilities was understood to be one of the prime reasons why Black infant mortality is from 2 to 5 greater than white infant mortality. Why white women why are 5 times less likely to die in childbirth than Black women, and why Negro life expectancy is almost 7 years less than white life expectancy. The Hill-Burton Act was federal policy that funded segregation. This act is known as the Hospital Survey and Construction Act of 1964, which allowed for racial segregation within the healthcare. The Hill-Burton Act was particularly known for the name of separate but equal. This means that they had discrimination against Black people were allowed. It was separate but equal facilities where they were built. Black and white patients were segregated by race. So the white facilities will have more money for funding, meaning that they had more money for research, more money for better equipment, more money for better staffing, and the Black communities did not have the same funding for the same reasons. And their buildings were not nicer, their equipment were not nicer, their staffing was not up to par. And I will be telling you guys the reasons going on. Black doctors blocked from white hospitals led to fewer trained providers, underfunded hospitals, denying life saving medical care, and long term mistrust within the system. With the Hill-Burton Act, like I was stating, this is why they had fewer trained providers because the funding was just not equal to what the white providers in the white hospitals were getting when it comes to the Black hospitals and the Black providers. They did not have the research, the education, or the equipment to better their knowledge when it came to helping saving lives. My view on this whole topic, at first I planned to focus only on racism in hospital today, but once I started researching, I realized that modern health disparities come from the history of hospital segregation. My project shifted to show how the government and medical system helped enforce segregation, especially through politics like the Hill-Burton Act. The biggest thing I learned is that segregation didn't end right away with Civil Rights Act. Some hospitals only changed because they threatened with losing federal funds. This helped me understand why racial health gaps and medical mistrust still exist today. When I think about hospitals, it will never just be sickness or healing. It will always be about older generation that the family carries. Segregation left fear that still shapes the way that older generations in my family seek medical care. They've always had this deep rooted fear that walking through the hospital doors meant that they would not walk out alive. My uncle had died at the age of 52 from stage 4 colon cancer. And the reason being was that he had this fear that he would not come out of the hospital alive, as well as my granddad. He died from severe diabetes. It left him blind. When I was born, he was never able to see me just because he did not think that the medicine that they were going to be giving him was equal or up to par that the medicine that they gave the white patients. On social media, I also see many people of color, especially women, sharing their stories about being treated with the same care or urgency as others. And one case that I can think of currently is this Black woman. She was in actively in labor in the waiting room, and the nurse, it was a white nurse, and she was not giving her any time of day, saying that she could not help her or she couldn't do anything to ease her pain, which as a nurse, your first job will always be to help your patients as well as trying to get their ease their pain immediately. And that's exactly why we've seen in the National Library of Medicine the person stating that why why mortality for infants is way less than Black mortality, as well as when it comes to babies and the mothers. And
Hi, my name is Khadija Slade, and for my deeper explanation, I wanted to really break down how hospital segregation in America wasn't just a matter of separate waiting rooms or different treatment areas. It was an entire system built into our laws, our funding structures, and the professional opportunities available to Black healthcare workers. When we started researching, I realized that segregation in healthcare wasn't just tolerated, it was protected and even strengthened by government policy. So we see this in Jim Crow laws that legally required hospitals to keep Black and white patients separated. Then the Hill-Burn Act came along, and that gave hospitals federal money to expand while still allowing segregation to be a thing. So that means that the government was literally funding inequality. So another important part of this explanation is that segregation didn't disappear the moment the Civil Rights Act was passed. And a lot of hospitals resisted integration for years after it became illegal. And many hospitals only ended segregation because they were threatened with losing federal funds. And that detail really changed the way I understood the timeline and how I even approached the project with this topic, because it shows that hospitals weren't rushing towards equality. They were literally just dragging their feet until they had no other choice but to do so. Um, so our research approach combines historical analysis, policy research, and personal reflection. We studied the legal foundations of hospital segregation, especially Jim Crow laws and the Hill-Burn Act, to understand how discrimination was built into the healthcare system. As we researched, we realized our original ideas, focusing only on racism in hospitals today, was actually missing the root of the problem. So we shifted our approach to look at the history that created these disparities now. We also use personal and community narratives to connect the past to people's real experiences going on now. So that even included some of our own family's experiences with medical mistress as well. This helped me understand both the structural and the human side of healthcare inequality. And then for my views, as I worked on this project, my views really evolved in ways I wasn't expecting. And at first, of course, I knew segregation existed in hospitals, but I didn't really realize and grasp um, to understand the structure behind it. The more I researched and the more I realized that segregation wasn't just a social attitude, it was enforced through laws and federal funding and decisions made by medical institutions. It was built into the system on purpose. So learn about the Jim Crow requirements and the Hill-Burton Act and how hospitals resisted desegregation really shifted how I understood the whole topic at hand. I think the biggest eye-opener moment for me was discovering that many hospitals didn't even want to integrate because they wanted to do better. They only integrated because they had to, and the government basically said, like, if you don't change, you'll lose federal money. And that really showed me that equality in healthcare didn't come from a moral or ethical change. It just came from force and pressure from the government and from a financial mindset and standpoint. And that really changed how I see the timeline of progress in America. Hospitals didn't rush to treat everyone fairly. They had to be pushed into it. And so this new perspective made me look at modern health disparities now in a whole different light.
Hello, my name is Amaya, and I'll be wrapping up the presentation on behalf of Joy. Her main point in the presentation was just to show examples as well as to wrap up what she learned through this whole presentation as well. Her main idea was that hospital segregation will always exist in many different hidden ways, such as Black patients often get the worst health care. Black healthcare also is very biased as well, and these issues affect trust in health within the health community. There are many different examples, such as Black patients often experience longer waits, poor pain management, and as well as dismissive attitudes. A female doctor from TikTok shared her staff questioned her authority because of her race. Research shows that the hospitals still separate patients by insurance income, which impacts Black communities the most. The TikTok that I will also be sharing is a Black pregnant woman patient. She was actively in labor in this video, and you can see that she was not being helped. The nurse was not trying to ease her pain. She was in the waiting room without being transferred into an actual patient bed, which shows that they did not care for her well-being at all. And I will show the video now.
Mounting concerns over this video that appears to show Carrie Jones in active labor at Dallas Regional Medical Center in Mesquite, Texas, last week.
Y'all treat all your patients like this or just the Black ones?
Jones's mother posting the video on social media.
I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork.
The family alleges hospital staff delayed Jones's care for more than half an hour. In a statement,
now that you've seen just a portion of that video, you can explain that's just a case that was shown on TikTok that was also being recorded. Just imagine the many different cases that we don't see, that's not being showed and that's not recorded, of Black patients that is getting treated less than just because of their skin color and is being normalized within the healthcare system for years. Like we said, this looks like longer wait times for Black patients. Pain, their pain intolerance, they don't care about, trying to ease their pain, not caring about. Also, as well as doctors, we also see the segregation within the staff as well. Many Black nurses, doctors, surgeons have to go above and beyond just to show that they're as needed as well as white staff. They have to go above and beyond with their interviews, with their resumes, just to show that they are as equal or even better than to be in this position. And her closing statement was, when you think about segregation, it never ended. Black and brown patients still face unfair treatment. In my opinion, everyone deserves equal care, and overall change starts with awareness and action, so why not start now?